What is this, 8977? I mean, I've been paged 3 times from this number. I don't even know what it is.
Dr. Gonzalez?
Hold on, please. I'm the chief right now. This is important. This is Dr. Gonzalez. Oh, hey, Joy. Yeah, did you try paging me? I've been getting this page from 8977. I didn't recognize it. I didn't call it back. Okay, so she's 5 centimeters. That's fine. Okay. Okay, just call me for delivery. I'm in clinic as chief. Okay, bye. Yes, I'm so sorry.
Hey, Dr. Gonzalez, I just need to check out this OB patient with you.
Okay.
She's a 24-year-old G3P2. She's morbidly obese, and she failed her 1-hour glucose test. And so I did a 3-hour, and I have the results here. There's only one abnormal value, but she's had a history of gestational diabetes in her previous pregnancies. What do you think I should do?
So, I'm sorry. She said she's really skinny, and so you did the diabetes test?
No. She's morbidly obese. She's had gestational diabetes before, and so we're just testing her for it like we always do. I decided to test her on the early side because of her history.
Oh yeah, of course.
Yeah, and then the 1-hour was abnormal, and so I ordered the 3-hour, and now I've got these results, and I don't know where to go from here.
Well, I mean, I'm your chief. You're the intern. Let's look at them together. Okay. So you see her 1 hour here, she had a 150. And
right, so that was abnormal.
Okay, that's good. I'm glad you picked that up as an intern. And then the 3-hour, I'm seeing some numbers here. And
yeah, I looked it up, and it's just this one number that's abnormal.
So, okay, so she has 1 of the 3 that's abnormal. So how many do you have to have for it to be diabetes in pregnancy?
I think it's 2. I've never had a diabetic patient before. You know, I'm just an intern, but I think it's 2. But I know she has this history, and I was just wondering, you know, is there something like a borderline gestational diabetic? I mean, does that exist? Because I know she's got this history, but there's only 1 abnormal value. I mean, what do I do?
You know, there probably is. I mean, there's borderline diabetics in regular patients. There probably is. We should probably ask somebody else how many values there are, because I don't remember.
Okay, I'll find one of the other chiefs.
Okay, that's fine, and just let me know if it's diabetic or not, because I mean, I'm the chief. I kind of need to know about the patient.
Okay, yeah.
Okay.
I'll look it up. I'll do a presentation
so, yeah.
on it. Okay. Oh, I think it's burning up in here.
Oh, no, it's cold.
Really?
Yeah, really is.
I mean, wow, like I'm sweating.
Okay, yeah. This patient's 9.
All right.
I think patient's going so fast. Okay, well.
Thanks, Dr. Gonzalez.
And so, so what service are you on right now?
Well, I'm seeing OB patients, Dr. Gonzalez. I'm on your team.
Oh. You're on my team?
Yeah, I'm on your team.
Oh, I thought you were on Jen.
No, I've been on your team for 3 weeks now.
Oh. Well, while you're here, can I ask you a question?
Yeah.
I'm really confused. This isn't, you know, I'm in clinic today. Here's my list, okay? Here's the patients. And I've got different colored charts. There's blue, and then there's orange. Well, I mean, I'm an OB chief. Why am I seeing 2 different colors here?
Well, I mean, I think that the blue ones are the Gen charts. At least that's what they told me. And you know how our clinic is. We see both OB and Gen patients, no matter what team we're on.
Yeah, this is just too confusing. I mean,
I think that's supposed to teach us, you know, how to go from different types of patients. You know, I think it's supposed to be a good thing.
Yeah, definitely. I mean, that's what I would think too. I mean, that's how I would do it if I were doing it.
Okay.
Yeah.
All right. Well,
okay.
Thanks, Dr. Gonzalez.
All right, get back to me.
Okay.
I wonder if we're having a party this weekend at my house again. Hey, Tomas, it's Mandy. Yeah, I was thinking maybe we could have another party, like, at the house for the residents, and even our other friends, too, since we have a lot of them, like, you know, 2 months down the road, Jell-O shots, dancing. I mean, I want all the chiefs to come. I mean, I know they don't come hang out much, but it would be nice if they came. Could you send that e-bite out tonight? Okay. All right. All right. Bye. Newman.
Hey, I'm Landro.
Oh. Well, do you mind if I check out the list to you tonight?
Okay.
You're back call, right?
I am.
Okay, so these are the onc patients.
Okay.
Dr. O is on for everybody. I think Dr. Phelps is off today, but you'll have to just look it up. I don't really know for sure, okay?
Okay.
This first lady, she's 45. She's day 1 from a hysterectomy. So her story is she like has this 8-month history of abdominal pain, some bleeding. She's not allergic to any medications.
So she's still at PCA. Does she have her catheter in?
You know, I don't remember. But you know, she rode a train from Missouri to come down here for the surgery. Yeah, and like her sister's friend's cousin, their dog just died. Okay, so you feel like you know her?
Okay, got it.
Okay, I think I pretty much gave you a good checkout on that one. This next lady, she's a patient of Stringer's. She's 37. She had this big dermoid. Oh, you should have seen it. There was hair in it. There was teeth in it. There was cartilage in it. It smelled funny. It looked funny.
So what kind of surgery did you do? Did you just take the dermoid out, or did you do a hyst too?
Yeah, you know, I wasn't there for this surgery. Why didn't I write it down? They took dermoid out. It's obviously, probably that's what they did. Just took the dermoid out.
Okay. Was it open, or did they do it through a scope?
Yeah, I think they opened.
Okay.
I mean, you're going to be doing bed checks up there. You can just look at the chart for these that I'm not really as familiar with.
Okay.
Just look at the chart. You'll be able to figure it out. This next patient, so she's 45. She has ovarian cancer. She's a patient of Dr. Phelps. She's here for chemo.
Okay.
And what's really, I mean, this is like her 3rd cycle of chemo, and like what's interesting is that she first cycle of chemo, when she got it, the very first time she got it, she might have had a reaction. Like she says, her tongue got really fat and got real numb, and she wasn't sure if it was that or she's also allergic to peanuts, and she thinks she might have eaten some peanuts before.
So she started the chemo this time yet?
The orders are there. You know, they wrote the orders for it to be administered. I think it's going to go starting tonight, and so like I'll just check on her in the morning. Don't even worry about her. She's not even that important. I mean, she's getting chemo. It's not even that big of a deal. I mean, just the allergic reaction, it's usually not a big deal. It's just, it's overkill. Okay, so don't worry about it.
Does she have steroids and Benadryl, or?
Yeah. You know, that once again, we'll just look at the chart. Okay, that's fine. This next lady, I did her surgery. I can tell you all about her. I feel like I know her real well. You know, she's 25. She had this huge prolapsing cervical fibroid. It was about, like, if I were to show you, it was about this big. And what happened was it was coming through. I wish I could take a picture with my iPhone. I could have shown it to you right now. And so, but it would smell kind of funny, you know, like rotten milk, sort of. And like, so what happened was, we were going to try to do it vaginally at first, then we looked at it, and then we thought maybe laparoscopically, and then we thought maybe robotically. Well, what's the difference between those two?
So how many days out is she?
Today, we just did a surgery.
Oh, you did today.
Yeah. So ultimately, I don't even know, we opened her up, okay? We made a fan, this is fan steel?
No, that's vertical.
Oh, okay, well we did a fan steel, and we took it out from there, okay? Took out both, we left her ovaries because she's 26.
Yeah,
I mean,
yeah.
she's got to have ovaries, right? I mean, she needs them for bones. I mean, otherwise she'll have hot flashes, I think. And so, anyways, I don't think she'll give any problems. You know, she's on a PCA.
Okay.
I upped it. I just gave her a quick dose of just one demand dose right now. So
what was her blood loss?
Yeah.
Probably
like, I mean, if I were to show you, the bucket. How big is the bucket? The bucket's like a couple of liters, right? I mean, it was probably about, the bucket was like this much full. It's like this fat too, so probably about this much full. And maybe like 2 of those.
Did she get blood?
You know, they were hanging some stuff. I looked over, and there's definitely albumin running because she was bowel prepped for this big surgery. And then there was this red bag, kind of maroonish. That probably was blood, but I mean, this is about the color of my hair. Do you see this? I mean, I just got this dyed last week. I mean, I got this girl. You want me to give you her number? I mean, she's really good. I mean, your hair looks okay, but I mean, if you get this shade, I mean.
Okay. Let's go on. Last one. Come on.
So this last one, she's. I just admitted her from the office. She's a patient of Dr. Matthews. She's ovarian cancer. She's dehydrated, and so you know, I don't have any labs. There's labs that are pending right now. I think I ordered CBC, CMP, MAG, FOS, ionized calcium. That's really important in these patients. I don't know if you know that. You're just a second year. So, where are you, second year?
Yes.
Okay, so yeah, there's ionized calcium. You need to look at that, and if you can't, you want to know how to calculate the dose to replace it. If you use your iPhone,
Okay.
Hippocrates, that thing has saved. I mean, 4 years I've used it a lot. Just look it up, put it in the calcium, and you'll be able to figure it out. Okay.
All right.
All right. Well, Newman, it was really good checking out to you.
My name's Lindsay.
Oh, I'm sorry. You guys just look so much alike. It's just so hard to keep you different.
Okay.
Hope your call is
All
good.
right. Thanks for the checkout.
All right. Good luck.